Good evening, everyone. Thank you for joining us tonight for CN Guidance and Counseling Services event, Circle of Love. My name is Liz Burke, and I am one of the organization's volunteers and a member of its board of directors. I am honored to serve as the MC tonight. CN Guidance and Counseling Services is an organization that helps Long Islanders recover from mental health issues. Tonight's event is centered on showing support and love to one another as we approach Valentine's Day. Mental health professionals at CN Guidance say taking care of oneself during this time is more important than ever. Once you can take care of yourself, you're in a better position to care for others. Tonight's program will be an opportunity to learn effective ways to take care of yourself, and your questions will be answered by our fantastic panel. If you would like to ask a question, please type the question in the Q&A below. There is an option to submit questions anonymously by checking off anonymous. Either way, only the panelists will see the live questions coming in, not the attendees. We will answer as many questions as possible. Before I introduce our group of panelists, Chief Executive Officer of CN Guidance, Jeffrey Friedman, will share a few words with us. Good evening, Jeffrey.
Good evening, Liz. Thank you so much. I really appreciate it. Tonight, we're going to start the conversation about mental health. You know, stigma taints and shuts down our discussion about mental health and hampers our ability to seek help. Well, tonight we're going to change the script. Mental health is part of our health, our overall health, just like heart disease, diabetes, stroke, cancer. We should be able to discuss those freely, just like we discuss mental health, and we're going to do that tonight. We're going to show that it's okay to talk about anxiety and panic attacks. And this conversation is more important than ever during the pandemic, COVID-19. Tonight, hopefully you will leave and not feel alone when you're here, that you'll see other people are going through the same thing and know that there's help out there. The most important takeaway for tonight is that there are places like CN Guidance and Counseling Services and other places all across Long Island and all across our region who can help. We specialize in helping people recover. We do it every day. Erin is very brave. Erin Colton is very brave for coming out and talking about her personal experiences. It's not easy to do that. And we are so grateful that she has the courage to be able to do that, because this is going to help so many people. I thank her for her honesty and how open I know she's going to be tonight. And I thank the panelists that are here tonight to add to the discussion. I think it's going to be a great evening. Thank you, Liz, for moderating this discussion. And also for volunteering as being a board member at CN Guidance and Counseling. Liz volunteers countless hours to help our cause. And thank you to each and every one of you who is participating and watching this in the audience tonight. We think this is really going to be a very impactful program. And if we'll be successful tonight if one person reaches out for help, which I know there are people out there who are suffering with a lot of the same issues that we're going to be talking about tonight. Thank you very much. Liz?
Thank you, Jeffrey. Our panelists in tonight's Circle of Love include featured guest News 12 Long Island anchor Erin Colton. She has been a bright light and true inspiration to CN Guidance, the Long Island community, and beyond over the last year. Through her genuine way of helping others and sharing her personal story, Erin was the featured speaker during CN Guidance's Hour of Hope in November of last year. The event garnered so much interest that CN Guidance decided to hold tonight's Q&A. Also speaking in the Circle of Love, Dr. Herschel Kearney, who oversees Wellbridge's medical and clinical program and is Associate Professor of Psychiatry at the Zucker School of Medicine, as well as Sherry Kaplan, a licensed clinical social worker at CN Guidance who has spent the last 20 years working in the field of behavioral health. Each panelist will share a few words with us, and we will start with Erin. Hi, Erin.
Hey everyone, good evening. How's everyone doing? So I actually just shared in my Instagram stories, which is where I talk a lot because I have no one to talk to all day. So that's who I talk to, all my followers. And I put the swipe up link for our what was it called, Liz? We had last
Hour of Hope.
Hour of Hope. So I shared that link to go a little more deep into what CN Guidance is about and what my story is about, particularly because I want to spend a lot of time answering questions with other panelists tonight. So if you want that, just go there and you can swipe up and watch that. It's on YouTube. It's really good. It was really great. But basically just my story is that I've had anxiety for about 10 years. And I only, that's the only time I know that I've had anxiety, like actually prescribed medication and therapy and trying to beat it, fight it, tackle it. I think I've had it my whole life. It started when my mom would call me her little worrier. And I'm sure that there's a whole lot of people on this Zoom right now where they grew up just worrying a little extra as a kid. Maybe you were in a group of friends where you were always the one being nervous or anxious about something. And you just wished you wanted to be like your other friend who didn't have those worries or feelings and didn't care what so many people thought about you. So that's how it started with me. Obviously, it grew once I got into the profession I'm in. A lot of people say, I can't believe that you're in this profession with anxiety. I have high functioning anxiety. So you really wouldn't be able to know that I have it unless you were a close friend of mine. I am an artist at hiding it. And that became a huge problem for me because I would lose friendships because I wouldn't be able to get to something because I had anxiety thinking the other person would understand. But they were like, well, we saw you on TV this morning. So that doesn't make sense. You just didn't want to come. It's not how it works. So I actually think, again, if you want to hear the whole story, you can go to that link. But I think the pandemic actually brought out a good thing in this community where a lot of people started opening up about their feelings. I think being home and being alone and being forced to spend time alone kind of purged this stuff out of us. So I think it's a great time for mental health and people kind of discovering themselves and now trying to help themselves. So I'm honored to be a part of this organization to help anyone I can just by my regular thoughts, which are your regular thoughts too.
Thank you, Erin. It is great to have you, and we are all looking forward to the Q&A portion of the program. Okay, let's turn to Dr. Kirani. Hi, Doctor.
Hi there. Thank you, Liz. I really want to just extend my thanks to CN Guidance for putting on such an important event, and in particular, applaud the courage and bravery of Erin to share her story and open herself up in a potentially vulnerable way, because often in the face of that, we're really able to connect and find themes that resonate with so many people. I will start by just saying that anxiety is perhaps the single most, or certainly among the most common mental health issues that adults as well as children struggle with throughout our country, but it still remains poorly understood and very often unrecognized. As an addiction specialist, it's really important for me to help raise awareness about anxiety, because in many ways, taking steps to manage anxiety effectively can help prevent longer-term consequences or other unhealthy behaviors, such as addiction, from emerging. And in particular, in the midst of the pandemic, I think we all need as much support as we can get. So I'm really excited, really hopeful that through this conversation, that not only will there be more hope, but that we can actually leave with some actionable new knowledge. So thank you.
Thank you, Doctor. Okay, let's turn to Sherry Kaplan of CN Guidance. Sherry, good evening. Just unmute yourself, Sherry. Thank you. There you go. We still cannot hear you. Doctor, can you hear Sherry?
I can't.
Okay. There might be something wrong with Sherry's audio right now.
How are we now?
Okay, perfect. Go ahead, Sherry. Thank you.
I'm so sorry about that.
No problem.
Erin, I was starting by thanking you. I want to thank you for your transparency and your willingness to talk about something that so many people are so uncomfortable sharing. As a licensed clinical social worker for over 20 years, I work in a private practice with individuals and families. Most of them right now are suffering with anxiety. Just so you know a little bit about me, I've also been an adjunct professor at Nassau Community college, and I do some guest lecturing at Adelphi University School of Social Work. So I see people throughout their life cycle, and I understand where these things start. Sometimes they do start in college or younger. Currently, I'm with CN Guidance now for 15 years as a division director overseeing clinical and non-clinical programs. My hope for this evening in this circle of love is that we can find some love and some compassion for those people that are suffering. We're all in the middle of an awful pandemic, something we never could have anticipated and certainly didn't have the tools to cope with. So I hope that we can learn a new language tonight, maybe come away with some strategies and some coping skills. And in doing that, we take away some of the shame and the stigma that comes with talking about mental health issues. So I'm really excited about it. Thank you.
Thank you, Sherry. Thank you for being here tonight. Now, before we start the Q&A, we do have a short video to present. I will ask the panelists to just mute yourselves and turn your video camera off, and we will show this short video. Thank you, everyone.
In every building, in every room, every acre, every day, addiction experts at Wellbridge are here for you and your family to encourage healing and hope. We provide medically supervised detox and evidence-based treatments proven to sustain recovery. Because Wellbridge is beyond a treatment center. It's the center of treatment. Call us at 844-935-5935 or visit us at wellbridge.org and take the first step towards recovery.
You went into business to do what you love, not to worry about employer responsibilities that can pull focus away from your core business. But we did. At Alcott HR, we have a passion for people and performance, and that same passion has driven us to provide expert support and resources to small and mid-sized businesses across the U.S. We're experts in the business of HR, payroll, benefits, compliance, risk management, training, development, and more. Let us help you grow. Alcott HR, a passion for people and performance.
Okay, let's start the Q&A. Our panelists can unmute and show their video camera. Great. And we will actually start with questions that were submitted via video. So the first video question is from Leslie.
Hi, my name is Leslie and I'm from East Islip. I have a question. I've never really suffered from anxiety before, but in the last year with all of the COVID stuff going on, it's starting to happen to me. And I've never had that happen before, so I'm really not sure how to deal with it.
Okay. Sherry, would you like to take that one first? You're unmuted again. Or the doctor.
That.
Okay, perfect. Go ahead.
So I too am anxious, and that should be setting me off, but I'm taking a deep breath and I'm not going to let my anxiety get ahead of me, and I'm not going to anticipate that that sound won't work again. So we're all in this together. And that ties into our taped question. Anxiety is new to many of us. We are feeling something we haven't felt before. It's normal to feel nervous. When it becomes something that takes over your life and your daily functioning, is impaired is when we start to really need to pay attention to that. So I would respond to that question by saying, you need to find a support system. You need to talk to people. You need to open up and be honest with those that are in your circle of love, your family, your coworkers, your friends. Also, there are some very basic things that you could be doing, certain coping skills that you may not know about. You can, I like to suggest to people to journal. I think it's very helpful. And even if you don't want to journal and you don't buy into journaling, I think if you took a book with the dates and numbered 1 to 10, how you feel. 1 is horrible, 10 is I want a trip to, I don't know where. And you can go back and check the pages. And if you have more 10s than 4s or 5s, you can track back maybe and see there are certain days of the week. Maybe it's Saturday. I have things to do with my obligations that are overwhelming to me. And then we can really hone in and see what exactly are those things that bother you the most. But overall, I would say you're not alone. We're all feeling anxiety right now with this pandemic. Talk to people, use some coping skills like deep breathing, meditating, journaling. And those would be my initial suggestions for you.
Thank you, Sherry. Erin,
I'm gonna jump right in. Yeah, I'm gonna jump right in.
go
Sorry, no filter here.
Absolutely.
So I just want, because I want to get to every question possible. So if you're feeling anxious during COVID and the pandemic, I almost feel like that's normal. Okay. I was out of control, out of my mind, anxious, when life was normal and much better, so I would kind of try to figure out for yourself, and you could do this with a therapist or even with your family or your friends, is it COVID that's making you anxious? And that's okay. And that should be talked about. But is it things more than that too? Because for me, it obviously was, because I am already treating my anxiety. The problem is that it's okay to be nervous about things. And this is just from my experience. I'm obviously not a doctor, but when it takes over your day and it ruins moments, it ruins situations and things that should be happy. I've been very open where I said one of the most anxious and worst days of my life was my wedding. And that shocks a lot of people, but I'm not here to try to be fake about anything. And that's 100% true. I was surrounded by my family and my friends, and it should have been the best day of my life. And it was the worst day of my life. So you have to try to tackle what exactly is happening. And it's so hard for someone with anxiety because you don't know what's happening. People always say, what's wrong? Everything, nothing. That's always my response, because you can't put a focus on it. But regarding COVID, I think that, as the doctor said, the best thing is to do is to get yourself a circle. It could be, if you're lucky enough that it's 10 people, wow. But for me, it's about 3. And I know that these people, they may not be people I talk to every single day, but they're the people that understand. And I think that that's the most immediate, best help that you could get.
Thank you, Erin. That's great. And we have a live question tying into this. It's been almost a year of this new normal. It is at a point that this kind of lifestyle does in fact seem normal. I've gotten so used to it that I'm already feeling anxious about adjusting back to the old normal. Do you have any suggestions on how to deal with anxiety of things going back to how they were? Sherry or Dr. Karani?
Sure. I will answer in part to Leslie's original question. She said something really powerful at the beginning by saying that I've never experienced anxiety before the pandemic. And to the nature of this second question, we are all in somewhat of a pitfall of recency bias, that we're only able to remember the last few days or weeks, whereas there was a whole world prior to the pandemic where we were dealing with all kinds of things on a daily basis. One of the major challenges with anxiety broadly is that it's often in response to the unknown, or the perception that what lays ahead is unpredictable and out of our control. So I think in many ways, one of the key places to start is to take an inventory of the things that you can control in your life, the things that bring you joy, bring you happiness, and in contrast, identifying the things that are actually causing stress or bringing negativity. And from that framework, you're able then to kind of really look and test what's real and what's not.
Okay. We have another video question, this one from Vanessa.
Hi, my name is Vanessa from Massapequa Park. I'd like to ask the panel if they have found a good way to explain anxiety to friends and family so that they will be more receptive to it.
So I had a huge problem with this, huge. And my mom is on now, and I'm sorry, Mom, but this is what happened. My family did not get it because you're talking about someone who's faked being okay for all of her life. As a kid, you know, she'd get stomach aches before tests and nervous before big job interviews. But, you know, so I've just made it okay. And now all of a sudden I'm coming out and saying, no, I have a problem and I need help and I need you to have more understanding. I can't come to this holiday dinner. I can't do it this year. And I'm sorry. And I know it disappoints you. And my biggest fear having anxiety is disappointing people and failure. But there has to be things where you have to put yourself forward in your recovery. And it's very hard to do because anxious people are some of the most thoughtful people. So what I do is I have recently found, I actually 9 years ago, I brought my friend over, who's the one who helped me to see that I really did have a problem and I needed help. He came and talked to my family with me. He came with my ex-husband and he sat my sister, my dad, and my mom down on the couch in my family home and said, this is for real. This is what she's experiencing. This is what she's been experiencing for life, but it's just never said because she's either embarrassed or scared. And that helps when you can have someone do that. Not everyone has that. So my biggest thing that I have had since the social media world has taken over are social media posts and articles. I always feel like maybe I'm not explaining something perfectly correct. So I like to send articles and quotes and things that are so me to people. And I also put it on my Instagram stories and I say, if you want to understand more, read this. Take the time and read it. And if anyone wants to jot things down, some of my favorite people to follow on Instagram to do that is My Self-Love Supply, Dear My Anxiety, and Anxiety Healer. Those three handles really do a great job at just simplifying our feelings. And it's almost like they tell the people who need to understand better than I can. So that's my piece of advice.
Karen, I have a question for you about that. Did you try to explain to them what it feels like to be in your body? Could they understand when you said it that way, that I might get sweaty or my pulse is going? Was that helpful at all to say to them, this is the feeling that I have when I feel anxious?
Yeah, it definitely was. You know, I would have points where, yeah, the sweating, the extremities going numb because you're trying to breathe so hard through an attack that the oxygen's not going everywhere anymore. It did. And again, my mom has always been a worrier. And so she could relate in a sense, but I blew them away. I don't really think they ever got it until years later, once they really saw the struggles I went through my divorce. And I would come home and sit in the corner of a room and not come out until I had to leave the house again. So it did help for me to be able to express a physical feeling. But it was hard, I have to say, for Vanessa. I'm with you. It was very difficult to have people try to understand because, again, they would see me on TV in the morning. They're like, well, you made it to work. You made it on TV. Most people can't even do that when they don't have anxiety. It's hard.
Right. Okay, third video.
Liz, I actually would, it's such a, Vanessa's question is just so rich. And I think is at the heart of what we're trying to advocate here to start a dialogue, engage your family, engage the ones in your life that you care for and are getting support from. But in a really important way, before you can really describe your experiences to others, there's a lot of insight and tools that can be helpful for you to gain insight yourself as to what it is you're actually experiencing and how to describe it. There are, I think, a number of terms in regards to mental illness, in regards to psychiatry, that are often used very liberally, like anxiety or depression, that even if we kind of surveyed the folks on this panel, that we'd have very, very different takes of what those terms mean. I think a useful first place to start, one very concrete example I'll put out is a systematic tool that you can use to take account of anxious feelings or symptoms that you may be experiencing. It's called the Beck Anxiety Inventory. You can just find that online, BAI. And often when folks conduct this inventory, they realize that, wow, I'm actually experiencing some of these things much more than I myself have even given time to recognize. And then from there, you start to at least build more of a vocabulary to describe the spectrum of experiences that can be related to anxiety. That those can be physical, emotional, spiritual, and psychological. So I think that's one really useful tool that that can help expand the language, not only for our ability to communicate to others, but for ourselves to gauge what we're experiencing.
Okay, thank you, Doctor. And we have a third video question. This one is actually for Erin.
Hi, Erin. This is Tammy from Seville, and I have a quick question. I am a huge fan and watch you every day. And on your stories, you have a huge cup of coffee. I was wondering if it's regular or decaf. And if it is regular, does it affect your anxiety throughout the day, since you have been open about it?
Tammy, thank you so much. And thanks for watching my stories. Yeah, so I get this a lot. Especially since like coming out and saying, you know, publicly that I have anxiety about a couple months ago. Everyone's like, well, why don't you put down that coffee and then maybe you'd be better? It's like, okay. But we'll get to that and things people say a little bit later. But coffee is definitely 100% something that could induce a faster pulse, you know, things like that. It doesn't for me, at least not the 1 cup of coffee I have in the morning. I would stop it if it did. It's not that important to me to put, you know, my job and my thoughts and my body in jeopardy. But everyone's different. And that's the whole point, is that you can't just say, hey, put that cup of coffee down and maybe you'll be better. But I think that it's, again, everyone's different. Everyone's body reacts a certain way and a different way. So for me, the coffee is okay, at least the 1 cup that I have in the morning. I don't have anything past that 1 cup. And again, like, give me a little bit here. I wake up at 2 a.m. So I almost kind of need it. And it almost like helps me on the other end of my mind. Like, I'm not going to mess up because my brain's going. So again, everyone's different. Just test it out for yourselves. I feel like the doctors would maybe agree with that.
Yeah, I think the doctor could probably address the physiological, but I think that's such an important question because it so oversimplifies the whole thing that we're discussing. If it were that simple, none of us would have coffee, right? So it's important that we have these conversations so we can broaden the scope and discuss really what the underlying issues are, and that it's not just the cup of coffee in the morning.
Okay, we have several live questions coming in. How do you differentiate between panic and anxiety disorder, and how large of a role do genetics play into it?
I'm happy to lead that one.
Thank you, Doctor.
Anxiety disorders broadly refer to an array of very specific diagnoses. And I think it's a really important question to help differentiate. Some of the common examples of anxiety disorders include phobias, like specific phobias where folks in a very defined context experience tremendous sense of fear or try to avoid those circumstances, versus the complete opposite end of the spectrum of what's called generalized anxiety disorder, where it's just this pervasive experience that's marked by, again, physical, psychological, and other emotional reactions. Panic disorder represents a very narrow spectrum of very, very intense physical reactions where an individual starts to feel like quite literally the world is going to end, the walls are caving in, can be coupled with really intense physical symptoms like difficulty breathing, elevated heart rate. So in some ways, it's a range of severity of the intensity of anxious symptoms, but also the time course, the frequency with which these events occur, and the context are important in being able to differentiate panic disorder from other forms of anxiety.
Okay, thank you, doctor. Another question. I'm the type of person who starts to imagine being fired when I am the top salesperson in my company, but that's how my anxiety and brain work. I head down a rabbit hole and have to pull myself out. Also, I have a nervous stomach, a disappointment factor, and people are shocked. I've seen a therapist and I'm skeptical about medications because my doctors seem to just suggest something so easily without even asking me a lot of questions. I'm not even sure I need medication.
Did I write that? I'm sorry. Was that my question? Because
It sounds like it.
It's unbelievable how similar people's thoughts are, and they think they're so alone, and you're so not. I said in the last Zoom that I would walk through the newsroom, and I'm at News 12 16 years, and I think I've done a pretty good job, and I think that I'm one of the hardest workers. I will not leave that place until the job is done and done 150%. I leave that day, I leave that place every day wondering like if my bosses are talking about me. And I've even had, my therapist is like, go to a boss that you feel comfortable with and share this. And I've even done that. And they call me crazy. Like, they're like, Erin, no, it's irrational thoughts. And that's what anxiety is. Irrational thoughts, fear of the future, fear of disappointment, fear of not doing good enough when you're doing more than other people. And obviously the doctors can expand on that, but your thinking is not crazy. It's my exact thinking. And the only way I was able to, and I know everyone's different, the only way I was able to shut that off a little bit, actually, no, not shut it off, because I still think it. Now I'm at home broadcasting from home. So now I'm like, I'm not even in the studio. So then they're probably talking about me, and I'm just being super honest. And the only way I was able to turn it down was with medication. And I'm just, yeah.
So when you asked your supervisor, how am I doing? And your supervisor said, great. Did that make you feel better?
In the moment, until I walk through the newsroom again tomorrow, the next day.
Right.
It's just, or maybe for a week.
Right.
Until, it's just, and I think to myself, and maybe this is going off the person who wrote that question. And I know that people wish like, oh, would you have it the other way of like maybe not caring? There are some days that, yes, I wish I just didn't care. I'm exhausted from caring, exhausted. But there's also days where it's like, no, I want to be on top of it. I want to be always caring and always thinking that like, I'm a step ahead. I can do this. I can do that. But again, the only way that at least I was able to even things out in my mind was with the right amount of medication. And I have to say it took about 8 years for me to get that medication correct. And right now I'm able to do that. That's not for everyone though. But I think that if you cannot shut it off in your mind for a long period of time, Doc, I'd say maybe it's time to think about what can help you.
Was there anything in between though? Anything in between medication? What did you do for all those years? Were there any practical steps? Remind yourself that supervision did go well, or asking for regular supervision, or reality checking with a colleague. How am I doing? Did you try any of those things?
Right. So if anyone's on here and follows me on Instagram, obviously everyone knows Sue, my photographer. She would be the person I would bounce things off on, being like, this woman is, well, how do I do on this? What do I do on this? What do you think they thought of me on this? And it would be great to talk to her because she would settle me. But again, she's my friend. And in my mind, I'm thinking, okay, how much? Yeah, she's not going to say I did bad. But there was a lot of therapy. There was, like I mentioned in a couple months ago, The Art of Imperfection. My therapist recommended that I read that because a lot of it was, like I said, I would say is instead of on a Friday afternoon live shot. I wouldn't be able to stop thinking about the whole damn weekend. It's something as stupid as that. And then I read this book, The Art of Imperfection. It didn't solve things for me altogether. But I now love that I am so imperfectly perfect. And if I don't say in the morning, I actually think something's wrong. And I like the fact that I've been able to come to terms with that with myself. It took a long time. You asked what I did? Therapy. I had to cancel my therapy at 3:15 today because I'm now coaching basketball. We're in basketball season, like surprise, there's basketball. And I was like, oh my God, like I got to schedule another one because it is like a part of my medicine. You know, people have to understand you can't just go right to medicine. It's not a magic pill like that. It is so much before that. So yeah, it was a lot of hard work, a lot of not understanding, but then a lot of days where you're like, oh, I think I was a little bit better today, you know?
Right. A question related to medication, asking about becoming dependent on medication. What about that piece of it?
Yeah, and you know, strongly connected with the prior question. There's a really complex relationship between the management of mental health issues and the use of medication. Unfortunately, the legacy in our society has been really mired by a lot of stigma, a lot of ignorance, and a lot of misunderstanding. In the context of something, again, we're all sharing the sense that anxiety is something very complex. The expectation that simply taking a medication removes this from our lives is just really misguided. And unfortunately, modern medicine and a lot of practices have started to reinforce that very idea that you see a doctor for 10 minutes, they quickly get a sense of what's happening and are very quick to write a prescription. To me, the foundation of really working through mental health issues starts with gaining accurate information. That's gaining accurate information about your own experience, but also the nature of these various diagnoses that we're discussing and how they impact folks' lives. There are a spectrum of non-medication based strategies that have been shown to be incredibly effective. There are also a number of medications that have been shown to be effective. And in some cases, the combination of the two, of a behavioral intervention plus a medication, is superior than either of those in isolation. And so those start to become really important conversations to have with a mental health professional that you trust, that you feel you can have, to me, the key, a collaborative process with, that it's not just here, see you later. And then to the next phase of, there are definitely medications that unfortunately remain very widely used for anxiety that have significant risk of developing dependence, as well as more bona fide use disorders. And that's a shared responsibility of the prescribers and folks that are struggling to make informed and accurate decisions. My position very simply on those is those are tools that are intended to be used either in very, very narrow circumstances, kind of like in case of fire, you break glass to get the fire extinguisher out, or they're intended to be used in very structured, time-limited ways. Unfortunately, the pattern that we do see still very, very prevalent throughout our country is that these high-risk medications are used as maintenance strategies where folks end up taking them for years, if not decades. And that certainly really can undermine their ability to build coping skills and have as healthy a quality of life as possible.
Thank you, doctor. What types of therapy will be best for teenagers with severe social anxiety?
I don't think it's a one size fits all. So it's hard to just say there's one type. I think right now, cognitive behavioral therapy, where you can really hone in and discuss what that issue is and help that person with coping skills. But I think it's a very personal relationship between that adolescent and the therapist to determine what works best for them. It's not as simplified as that.
I have to say that my niece Peyton, she's 10. She's already shown signs of anxiety. And my sister has already actually taken her to a child therapist just to talk, just to talk. I do it when I can and when it's appropriate, because she knows a lot about me, and she knows that she's a lot like me. And so she knows that, like, her aunt that a whole lot of people watch on TV every morning, if she can get through something, then she can too. And there's lots of conversations. So just coming from someone who I never had the chance to attack this as a kid, help them, talk to them, don't smother them, but just keep the conversation going. Don't make it like they cannot voice that they're struggling.
Great. This one is more of a statement and not a question. I take meds and do CBT. What has worked for me the best is a combo of both. With that said, I worry that I will always be alone. When I get that thought, I try to take a deep breath and try to change my way of thinking. It seems to work for me. I have an imaginary toolbox of things I use to get over the panic and anxiety. What do you think of
Amazing.
that?
Sounds like a smart person.
Amazing.
Right? Great.
Yeah, I mean, same. Hi, 38, not married, no kids. I have a fear of being alone for the rest of my life. Listen, not a day goes by that someone you think has it all is struggling deep down. We've said it a lot here, but the toolbox is great.
Mhm.
It took me so long to be able to create my toolbox, but I have it, and it's places I go, and it's things I say, and it's things I do when I know I absolutely need to. The whole mix of whatever works for you, whether it's, your toolbox, your medicine, your CBD. I know that's been helping a lot of people. It doesn't particularly help me. So it's all things that you have to try structurally with, I would say, your doctor and someone who knows a lot about it. But listen, just that statement alone, you're making it through. You're making it through. You got all the tools. And that's, I don't know. I think it was a super, super brave comment.
Thank you, Erin. Are there any medical problems that can mimic anxiety or panic attacks, and how would a person find out more about this?
As we've kind of named previously, anxiety can manifest in a variety of different ways. So there's certainly underlying medical as well as other psychiatric conditions that can present with a number of the feelings and experiences that we're naming. If someone is genuinely concerned of some underlying medical issue, I think the most straightforward place to start would be a conversation with a primary care provider to characterize if there are other culprits. From there, usually the steps would be evaluating basic laboratories and just assessing someone's general health. A common condition that can present with a lot of physical and even emotional distress is diabetes. If someone's sugar is running high or low, it can create a sensation of fatigue or the opposite of feeling kind of restless and anxious. So that's one very simple example of a condition that certainly could be experienced as anxiety.
Okay. Another question. I know this year is difficult for everyone, but it's so overwhelming. I get irritable and snappy, and I can't calm down enough to get everything done that I need to. What can I do to relax?
I think that came up before. The word irritable came up before, and we were talking about how to describe to your family. And I think that sometimes discomfort shows in a way that's off-putting, right? You could be depressed, but moody. You could be anxious, but irritable, and take it out on the people that you love. So I think it's also trying to identify why you're having that reaction and be able to explain to people, because people don't necessarily look past the surface. They'll just call you an irritable, cranky person when we know there's something that's deeper and more going on. So I think it's about identifying why I'm having this response, why I feel this way. Can I take a deep breath before I make that statement? Is this something I should just keep to myself and I don't have to word vomit on someone because I don't know another way to share it and it triggers me and so it just comes out? So I think that irritability is something so much more. So
I have a quick couple of things that I do at least. Obviously, everyone is in this, and I don't even have kids, so I can't even imagine, being stuck inside with 2, 3, 4 little ones. And I have a lot of friends who have that. So I have one friend where we have a knowing thing that where we can call no matter what and just bitch and explode and word vomit and it will never be brought up again. So again, not everyone has a relationship with someone like that, but I know that I have one person that in the pits of it, that's the person I'm calling. The other thing is I also try to, with this person, actually, I also try to make things to look forward to. I know it's like a super simple thing and it doesn't have to be a trip, because who's going on trips right now? It could be, a block of time where I have 2 hours where I'm going to sit in the bath and read a book or drink a glass of wine or go out to dinner if you can. Knowing I have that to look forward to, like I'm going to see this person on Friday and she needs a break and I need a break. And I'm looking forward to that on Friday, getting me through my week. And when I have bad times during the week, I'm just like, okay, it's going to be Friday soon. It's going to be Friday soon. So they may be simple little things, but they help me.
great.
Great, something to look forward to, right? Another question, this person says that she is very busy with work, with her children, doesn't have a lot of time. How can she take care of herself? So this goes back to self-care, which is one of the reasons why we are here in the Circle of Love. Thoughts on that one?
Yeah, Erin, do you want to talk about your self-care and then we can elaborate because that's so important and you keep alluding to that with the bath, with friend time, with going out for dinner if you can, a glass of wine.
Yeah, so I mean, obviously self-care is amazing and something that everyone needs. People with anxiety tend to, especially if you don't know you have it or you don't know how to deal with it, you kind of suppress it because you don't want to either admit that you need a second or self-care or you don't know how to ask for it. That's a huge thing.
Yes.
One of my friends, finally is open with her husband about, they've been together for a whole year. I mean, they didn't leave the house for so many days. They were one of those people. And I said, it's okay to ask to just go out and be by yourself. It doesn't mean you don't love him. It doesn't mean that you don't love your children, but you need to love yourself. And I mean, it's people sometimes when I try to give advice about this, I feel like an idiot because I don't have kids and I can, give my self-care a whole lot easier than my friend can. But I'm coaching a basketball team. I get up at 2 a.m. I'm going to get probably only 3 hours of sleep tonight. Like it's something you have to put on your list. And if you do not do it, you're doing it wrong. Even the simplest of people who may not even have huge problems or huge irritability inside their home, you need to do it. You need to put yourself first because when you put yourself first, you're putting others first too. You're not then being irrational and freaking out on your family because you were able to take that time to settle down. You're not being a good family member if you don't give yourself some sort of self-care.
I think it's great that you said family member, but women in particular tend to struggle there, I think, more. So you're right about that you can't give if you don't have it to give.
I'll add, one of the real paradoxes is as someone starts to experience more and more intense anxiety, it feels like there's less and less time. Yeah. And so it starts this really dangerous kind of avalanche. One of the really actionable domains of self-care is in the broad umbrella of mindfulness-based practices. They certainly, over the last, I'd say 10, 15 years, have started to get a lot more attention from self-help books to online platforms and tools that you can download as an app even. What I always really try to emphasize though is these are practices that you have to keep cultivating in your life. It's not just the standalone, okay, I meditated for 10 minutes, why am I still anxious? In regards to the question that's being named for the busy mother who's basically managing 10 jobs at once, to be able to cultivate practices that she can use when she's waiting in the carpool at school or dealing with a frustrated infant. That's when the mindfulness practices really become valuable because they're integrated that into one's own life and become not just this standalone tool, but actually a way of being. I'll just mention one practitioner that I think is really one of the forefathers of American mindfulness-based practices by the name of Jon Kabat-Zinn. He has a lot of great content on YouTube, but hopefully can kind of provoke a bit more searching and curiosity about that domain. There's now dozens of different, if not hundreds of different types of practices. So finding one that really resonates with you, that you can start to incorporate throughout your day is when I think it becomes really powerful.
Just quickly, there's also sometimes, and again, I'm speaking from my sister, my friends, when you're in a relationship and you have kids and one of you has a pastime or something to go to or something that you've had all along or whatever, like for instance, my sister's husband plays soccer. So he gets to go with the guys at night or certain points of the week and play soccer. And, a resentment builds because my sister's like, well, I'm home with the kids. I don't play a sport. I don't work out. So there's almost like an anxiety of not having a pastime, so it's like it almost like grows and grows. And then it's like your husband or your wife are like, okay, well, find something you like. And that doesn't help. So talking about this with my friend Kristen, her same thing. Her husband does like MMA stuff and goes to a gym. And she's like, okay, so now like I'm being punished because like I don't go to the gym. And so we were sitting one night and I was like, well, what do you like to do? And she's like, I don't know. I like talking to you and drinking. I'm like, Friday night, you're doing your pastime. You're setting a date to talk to me and have a glass of wine. It doesn't have to be something that's active, that is, going to make you skinnier, going to make you healthier. It's something that's going to make your mind healthier. So people should realize that as well.
Erin, can you repeat the Instagram pages that you follow?
Yeah, definitely. So I love them. I post them on my Instagram all the time being like, read this. So the first one is Dear My Anxiety. That's probably my favorite one. The next one is Anxiety Healer. And then the third one is My Self-Love Supply. And then when you follow those, other suggestions for other anxiety sites that, listen, they're not like, be like, oh, do this and you're this. They're people like us. They're people who know. So they're just like, hey, you're feeling this? That's okay. So am I. So after I read these posts, I don't know, I feel more normal, if that makes sense.
That's the whole point of this, to normalize it.
Yeah, right.
That's right. A lot of my anxiety is about my fear of failure. I literally can't breathe if I don't get a grade higher than a B+ and feel dizzy and hyper-focused on failing. What's the best way to handle this?
I don't know. If you let me know, let me know, because I still am struggling with that, and I'm out of school 20 years now. So,
all right.
I feel
Sherry
taking over. Yeah, Sherry. I don't know. For me, I didn't have the chance to seek help because I just thought that everyone felt that way. I thought everyone threw up before the first day of school. I thought everyone went home crying when they got an A- instead of an A+. That was just life for me. Now I know that that's not. So I see through my niece and my nephew ways that they react, and one of them cares, one of them doesn't. So for the people who care, I don't know. I guess what I would have wanted back then is, and which my parents did do, was just say it's okay and go through ways about, if they wanted, make it better the next time. But just try to normalize not having to be the best and get 100 every time.
I could speak to that as a clinician and as a parent. So as a parent, I didn't care what my child's grades were. I had a daughter. I just wanted her to be happy. And if that meant a C, she'd figure it out later. But it was much more important for me to instill a sense of happiness in her than that competition where she'd always feel like she was failing. She wasn't a great student, and that was okay in my house. That's not okay for everybody else. The nice thing now is that we are normalizing this, and so are schools. Schools have guidance counselors and substance abuse counselors and other supports within the school that kids could go to. And that was also something I told my daughter in each school, whether it is elementary, middle, and certainly before she went away to college. I went ahead and called the on-campus clinic, of course, as a clinician, to introduce myself, but just to make sure she knew that she had a place to go. And she started therapy at 5 because I always wanted her to know it was okay to speak. And if you can't speak to me, you'll find someone to speak to. So as a mom, those are just things that I did. But I would say the mindfulness, talking about it with your teachers, getting extra help in school if you feel that that's an issue. Those very practical things are important.
Also SATs, you know, they're becoming less of a thing. Thank God.
They are.
You know, like my anxiety would take over that I was spending too much time on a question, that I wasn't gonna, that this test decided my future, you know, like,
Right.
Thank God people are realizing that that's not the way to go, and getting more life expertise and life things into getting these kids into colleges and doing what they need to do.
Yeah, they're doing away with them now, I think.
Yeah.
During COVID, the SATs and the ACTs.
And one of the attendees is saying, I think that person needs restructuring of their thought process. What does it really mean to get a B+ or lower? I think perspective is so important.
Well said.
Okay.
Or what's the worst that will happen? Sometimes I do that
Right.
for myself, you know,
Right.
like people with anxiety are worst case scenario people. I jump off a bridge every day in my mind, every day. There's nothing that goes from a problem, a little tiny problem, to me being like, and my house is going to be blown over in the wind and I'm going to need a new house. Like tomorrow, there's going to be a little bit of a storm. It's like, oh, well, I'm going to slip on the ice. And it's just worst case scenario is constantly going through your mind. So, you know, one piece of advice that I got through the years is, okay, and if that happened, like you'll probably find a new house, right? Or, you know, like going there. Okay, you want to go there?
Right.
Let's go there. Let's go to that worst case scenario. And guess what? You're still going to work your way out of it. It may suck, but you're going to find a way out, and it's not going to end your life like you think. So it's also putting yourself into the worst case scenario that you're thinking and saying, that's okay. You got an 85. Okay, so next time you'll either still get an 85 or you'll get a 95, and you'll probably end up in the same spot that you're in if you continue to work hard.
Great.
Liz, I'll add to the
Go ahead,
restructuring
Dr.
comment that, you know, in the context of CBT, cognitive behavioral therapy, a lot of attention is given to common thought distortions, which are really common unhealthy patterns or reactions in the face of different stressors in our life. So the nature of this young person's question highlights one of those common distortions of just labeling, that they're very quick to kind of label themselves a failure. And that evokes, you know, a whole slew of things as to how they're arriving at that conclusion. What are the things they value? What are the things they believe? And sometimes the first step is just recognizing where that labeling pattern is playing out, and then finding ways to either eliminate that behavior or cope with it in a more constructive way.
We have an attendee with regard to the school question saying, when I was younger, I would get punished if I got a bad grade. It put more pressure on me. I feel that encouragement would be best in my personal opinion. The what ifs are what causes the biggest anxiety for me. I had to try to give up the what ifs.
Well, I mean, also parents listening on this right now, obviously you have to present an environment with your children that is not the way to go. You know, structure and discipline, that's one thing, but false expectations and stress, and you are creating someone who is not going to be able to deal with things further down the line or have difficulty doing that.
That sounds like a really wise young person.
Yes.
You know, in some ways in school, we're taught how to think and how to behave, but we don't really systematically teach anyone how to feel. And the real spirit behind this very conversation is raising the fact that we're all having these complex feeling experiences, some of which overlap, some of which are unique to ourselves, but through dialogue, through gaining wisdom. And here, I didn't think we cut their name, but a young mind is offering us a lot of wisdom.
That is true. Can you comment on how turning to substances, alcohol, or other drugs to self-treat your anxiety can complicate your anxiety?
100,000%, 100,000%. You're looking at someone who likes to put down a bottle of wine on a Friday night because they've had just too stressful of a week. And, we're being honest here. But then that Saturday morning, you have something called an anxiety hangover. And you think that you put yourself in worst case scenarios when you're not hungover, but you have the weight of the world. You think everything you did is wrong. And I think everyone has experienced anxiety hangover in a certain point, whether you have anxiety or not. But it's, it's dehydration, it's not feeling good, it's everything. But when you have anxiety, times it by 1,000. So I've had to learn about that a lot. I mean, I'm not that, it went so bad for me that I was relying on alcohol, but yeah, like I just said, I had a tough week, grab a drink. Who doesn't say that? But it's when you're drinking to forget or even like eating or doing any addictive thing to forget or take yourself out of a situation, you have to, that is a warning sign that you are just burying the problem and it's going to become bigger. It took me, I'm still working on it.
Anything to add from Sherry or the doctor on that question?
That's a really a very powerful question. To get a little philosophical for a moment, I'll say that one of the most beautiful properties when we look out in nature is that things exist in an equilibrium. And if you push one side of the seesaw, it generally has a reaction in the opposite direction. And when we look biologically, psychologically at the way our brains and mind function, that equilibrium is really manifest in such a powerful way within each of us. Alcohol is a really prime example of something that primarily operates as a depressant. When you're feeling stressed, worked up, etc., it allows you to have that kind of antidote to feel relaxed. But over time, what happens in really, really profound ways is the body and the brain start to compensate in the other direction. And so you actually start becoming more and more anxious when you're not drinking. And that's usually the kind of early precursor where problem drinking behaviors then start to escalate to more consistent and sustained use. You'll find very similar patterns with a variety of other drugs of abuse or even prescription medicines that are misused. So we are all very, very delicate beings that embody an important balance. And I think we're trying to highlight here how self-care is really a powerful equalizing force to maintain that balance.
Thank you, Doctor. We've had great questions coming in, important questions. Are there any final thoughts from the panelists tonight?
I mean, I have so many thoughts. So just tell me when to stop, basically. I think like the most important thing to understand is that we're all works in progress. Am I right? It's just you can be told how to do it. You can be told how to fix it. And that is not the case when it comes to anxiety. I know that I'll be working on myself and trying to figure this out for my entire life, probably. There may be some easy years. There may be some really bad years. But with the amount of help that I kind of experimented on, meaning, a psychiatrist, a therapist, now medicine, I feel like I finally, for the first time, have figured out my flow and ways that I can talk myself out of really, really, really bad moments. Do I still have panic attacks? 1,000%, 1,000%. But you need to work to get it to few and far between. So give yourself a break. That's my biggest piece of advice when people come to me and ask, like, when I started giving myself a break and not saying yes to every damn thing and not putting so much pressure on myself, which again, I'm not telling you just to not do it. I do it every second. But when I start easing up on myself, it gets a little bit better. And again, the quote that I said last time that everyone loved was, and this is just what I think on a normal basis, ride the wave. Ride the wave. The moments are not going to go away. They're going to be there. But in the moment, just get over those thoughts, those one thought, these couple of thoughts that are affecting you right now. Try not to fear the future so much. Try just to ride that one wave, then see what the ocean has in store for you. And maybe another wave, and then you'll ride that one. But it may also be clear. So ride the wave, and also anxiety is not a weakness. I choose to think it's an authentic character trait that needs a little support sometimes. I own my anxiety. I own it, and I think it's a part of myself. And the moment that I started loving myself for being able to work on it and knowing I have this thing about me that I'm always going to have to work on, I don't makes it okay for me. It's a little bit more of my imperfection.
I have so many things I could add to that, but I just want to touch on that. It is only one part of you, and I think that's what people need to remember. We're not defined by that label. You are so many more things than just the anxiety. You could list 100 things, and the anxiety just goes to the bottom of the list. So I think that's important for people to not label themselves. I think my goal this evening, and I think the takeaway, is that it's okay to talk about it and to know there are people that are well known that do find ways to get through this, and that there are coping skills, and that there's hope out there. And by talking about it, we're taking away the stigma and any shame around it.
Thank you, Sherry. Doctor, your takeaway?
You know, to me, the goal of life is by no means to be anxiety free. In many ways, the things that we are anxious about are the things that we value most and hold dear. So if we had no anxiety, it would probably imply that we didn't have anything that we really valued. And that
I love that. I love that. It's the first time I've heard it like that.
So with that, I think I certainly hope the takeaway for our audience is that there are effective ways to manage when anxiety is getting in our way. But sometimes riding the wave of that anxiety is really how we really become the best version of ourselves.
All right, one last thing. As always, if anyone wants to message me or ask for something that I did, maybe I answer literally every single message. I spend hours on my day making sure I answer everyone's messages on Instagram, primarily Instagram. You can also Facebook me, but primarily Instagram. I know that a lot of people have started kind of their journey because I opened up about it. So that doesn't mean that's just, I'm putting a post out there. I'm fully talking about this with anyone who wants to. So I'm not a doctor. I'm literally just telling you how I went through this whole journey. So message me and I'm happy to give you advice just from me.
Thank you, Erin. That's an amazing offer. Thank you for giving us great advice tonight from your personal perspective. Thank you, Dr. Karani and Sherry, for your helpful and valuable input in your respective areas of expertise. If anyone would like to donate to CN Guidance and Counseling Services, which helps Long Islanders dealing with mental health issues, please text Circle of Love to 44321. Again, to donate, text Circle of Love to 44321. You can also visit cnguidance.org to contribute. That's cnguidance.org. Thank you everyone for attending tonight's event. We really hope it has helped you. Happy Valentine's Day, and we hope that your holiday is filled with love. Good night, everyone.
And don't worry if you don't have a date. I don't either.
Thank you. Good night.